All right. So welcome everyone. Thank you so much for joining us. We're really lucky to be joined by Sarah Gill. She's a highly experienced lymphedema practitioner. She's got a background in education. Sarah regularly presents, and she's presented to Think Pink before. Worked closely with Jamie. So she's here to share her knowledge with and expertise with us. So welcome, Sarah. Thank you.
Yeah, thanks, Christina. Thanks for the welcome. And hi, everyone. Nice to see you all there on the other line. So I'm going to start a PowerPoint in a moment, and a few of those have videos and things. But yeah, just with what Christina was saying, I'm a lymphedema practitioner. I work in regional Victoria. And so as part of that, the clients that I work with lymphedema is pretty much everything. I see the whole broad range, but I do, of course, see a lot of clients who have lymphedema post breast cancer treatments. And I've really kind of gauged my talk today with along the lines of some of the questions that they often ask me, and also just to explain some of the basics to you. Some of these slides, if you've seen one of my presentations before, they're part of some other presentations before that I've put in because not too much changes with information since last year, but I'm hoping that this will give you a kind of a good background on what the lymphatic system is, what lymphedema is, what to look out for, and also how we treat it if you get it. And most importantly, just to probably help you get a little bit more back in touch with your body as well. So I've sent Christina also some documents. One of them is Tai Chi, which is just like it's a YouTube video I found on Tai Chi, 7 minutes. And it's really great because it involves a lot of this chest expansion and arms, which we want to do for lymphedema of the chest and arms. So here I go. I'm going to press share. I haven't used Zoom for a while, so we'll just, I think it's going to be okay, right? So here we go. I'm going to share that. And now I'm going to do this. And I'll just go back to the start. I was just looking for it while I was writing, and that's it. Can everyone see my page?
Beautiful. Thank
Yes.
you.
Whew, excellent. That's the first part done. Technology is working. So that first of all, I'm going to go like, what is the lymphatic system? So in particular, where is it? And you'll see with this image on the side, that's pretty much showing what we call our deeper lymphatic system. So that's when you think of your nodes, you think of pelvic nodes, you think of, we know a lot from breast cancer about axillary nodes, but that's our deeper system. And that only takes up about 20% of our whole lymphatic system. 80% of it actually sits in between the muscle and the skin, and that's in that subcutaneous tissue. So it sits in between the muscle and the skin, and that's really important because when you develop lymphedema, if you do develop it, you don't develop it in these deeper systems. You can develop it because you've got damage to those deeper systems, but it actually develops between that space between the muscle and the skin. So the lymphatic system is everywhere. Yep. So only 20% is this deeper system of lymph nodes and 80% is superficial. And the most important thing to think of is just that it's a network. So it's a network of deep and superficial vessels. And it's when you were a little embryo being developed, your lymphatic and your venous system gets developed at the same time. But the lymphatic system, you'll see on this next slide, what's really interesting is that it's actually an open-ended system. So whereas with your venous system, your heart, that's a closed system, and we get this return of the blood all the way through from pumping of the heart. Our lymphatic system, its main job is to maintain fluid levels in your body, but it's actually an open-ended system. So it sits in the tissues and it's connected, which I've got a great video to show you, by little collagen fibers to the skin, these little micro initial lymphatic collectors. So I like to think of the lymphatic system as a bit of a pump, right? But it's a pump that we want to, it's kind of drawing the fluid back from the tissues into our system. So its main job is to maintain the fluid levels in your body, and also it helps to transport and remove waste products and abnormal cells from your lymph. So that's just to show you with that picture, like that the green is the lymphatic system, and you can see they're kind of open-ended with those arrows. And that's where the fluid, the excess fluid from the cells and tissues goes into the lymphatic system there. I'll explain soon where it all goes once it's been collected. If you've got questions as well, feel free to write them down. And even if today I don't know the answer, I'll try and find out and get back to you. So here's our lymphatic system, our pump. And this is a very initial lymphatic vessel. So this is like a micro vessel, and it is then connected to deeper vessels. And these little lines up here, these are our collagen fibers. We all hear about collagen a lot, but that's attached to the skin. And when we move the skin or when we move our body, what it does is pull on those little collagen fibers to open up the lymphatic vessel. And then it also helps to change the tissue pressure in that area as well. So I'll just show you this little video. So you can see this is what we mean by an open-ended vessel. So it sits there, starts to draw in some fluid, and then you can see the lymphatic system starting to pump a little bit. And then it starts to go into this deeper system. I like to think also of the lymphatic system. I use the analogy a lot with my clients. It's a bit like a train. The more passengers on it, the more efficient it is. So most of the time, your lymphatic system in your body just sits at around 20% capacity. I'll just play that video again while I'm chatting, so you can have another look. So it sits at about 20% capacity, so that when you get sick, it can accelerate to find out what's wrong with you, when you get a virus, and that's why your lymph nodes swell. But what we can do through manual lymphatic drainage and also through moving our body, deep breathing, doing things like the Tai Chi, is that it helps to pull the fluid back into those initial vessels. And then the more fluid we have going through the lymphatic system, the actual more efficient it is. And here, these little sections that you've got there in the video, they're called lymphangions along here. So these are these little sections through here. So yeah, we've got our lymphatic system, it's the pump, we've got the fluid, we've got our pipes, which are these micro vessels and then larger vessels. We've got our, if you think of the lymph nodes as our filters, and then it eventually all enters into our collection ducts, which is the thoracic duct and the right lymphatic duct, which is just below your collarbones. So if you ever go and see a lymphatic therapist, they're often doing work around your collarbones here, because I'm a Vata trained therapist, and we call this the terminus, but that's where all of the lymphatic system links into your venous system. Then it will go out through your kidneys, and you go to the toilet and wee it out. So this is to show a little bit more just about how the system works. So I mentioned before about doing Tai Chi and things. So our heart, our venous system has the heart to pump it around. Our lymphatic system, it's a really slow system. It takes 18 hours in a healthy system for the fluid to get from the top of your finger all the way here and into your thoracic duct, or your right thoracic duct there, or the thoracic duct there, depending on which side. The leg, right, it takes 24 hours to go through here. So it's a really slow moving system. So often if you develop lymphedema, it's actually quite slow. We really rely on muscle movement, because muscle movement helps to open those initial lymphatic vessels, and it also helps to change the pressure in between the skin and the muscle. And that we rely then on internal and then also external pressure as well. So that's where compression garments come into. As I mentioned before, it's got the capacity to really increase when the job is required. So here's just showing, this is showing that right thoracic duct, and all of the rest goes into this thoracic duct here. So interestingly, with and this is very intriguing in regards to breast cancer, is that all of this part of the body drains into this thoracic duct, and then this section here drains into the right thoracic duct. So, what causes our lymph system to fail? So, pretty much if you think of your plumbing again and your pumps, so it's damage to the pipes, right? So for us, that can be, I see people who've had trauma to their body. It can be accidents, it can be surgical, and it can also be damage to those really initial lymphatic vessels. And that's what's really important, because sometimes with the treatments that we need for breast cancer, we need to do things like radiotherapy. And radiotherapy like that is fantastic because it really does its job, but it also does damage those really initial lymphatic vessels. And then that can make it a little bit harder for those initial vessels to pull in the fluid. Also, what can happen is that your lymphatic system can have increased load. So increased load might be perhaps you've had a skin infection, and that means that you've got actually more fluid sitting in that area of your hand or on your skin. That can be increased load. It could be a burn. It could be something like that. Also, you could have a change due to cellular function, and we get this process of osmosis where lymphatic fluid is very protein rich. So in this space between, here's our skin, here's our muscle, between this space, it wants to draw. What happens is sometimes fluid coming through in our venous system goes, what's happening over there? There's a lot of proteins, and that wants to come across into that space. And then that creates more proteins, and then that creates more fluid across. So that's called filtration as well. So what we want to do is really compress this space sometimes. This is a really great video because here we've got some damage to our deeper lymphatic system. And these indicate the little proteins in the lymphatics coming out. And what we're going to see now, so it's leaking into the area. So here's our muscle bed down here. But what you see here in this video is that our body is so clever. It's got these little anastomoses. So it's got these little kind of side pathways that can connect through one lymphatic vessel to the other. So we can redirect the lymphatic flow through there, but it won't actually kind of connect through until you've got enough fluid going through the system. So that's where moving your body around and compression and doing things like manual lymphatic drainage really help. So I'll just show that video again. The one thing that I really want to share with you today is that lymphedema is really slow developing. I'll show you some categories in a moment, but sometimes post breast cancer surgery, like I'll have patients come in and they're still perhaps just 2 months post-treatment. They might have just be starting their radiotherapy and they're worried about the swelling that they're starting to get on their breast. And certainly I'll give them some things to help with that a little bit, like maybe suggest a different bra or compression, or there's a lot of products that you can put in between your breast and your bra to try and get those initial lymphatics to move. But the main thing is that sometimes you've just got general post-operative swelling as well. So, if you've had a big surgery, you're going to have some post-operative swelling. So, lymphedema is usually quite slow developing because of this cycle of the proteins and the fluid between the muscle and the skin. So, you'll hear the word edema a lot, and edema just means swelling. And we can have lots of types of swelling in our body, and actually sometimes we want to have swelling because we want to find out what's going on. So here you've got an ankle. This is more like from a sprained ankle. You've got this acute swelling. So that's something that's just going to come on pretty much straight away. And then we've got chronic swelling, and that could be something more like a bursitis or tennis elbow, or something where you've just got this fluid in the joint a lot, but that is still a different kind of fluid to what we've got down here. And this is what we call complex. So the complex is more lymphedema. So that's where we've got a dysfunction to the lymphatic system. So that's the difference between acute and chronic swelling. And lymphedema is more this complex swelling that's taken a long time to develop, and the swelling itself is in between the muscle and the skin. And lymphedema, so as I said before, I can see people who have lymphedema anywhere on their body. So it might be some neck, some face, genitals, arms, legs. Interestingly, lymphedema is classified into primary or secondary, and primary is if you've got a birth defect or you've got some congenital issue, and that's pretty rare actually. Only about 10% of people who present with lymphedema have primary lymphedema. That can also be from things like amniotic band syndrome, like a few different things like that. Secondary lymphedema makes up 90% of the cases that come into a clinic. And as I said before, some of that can just be from general trauma for the body from an accident or from surgery, not necessarily cancer related. But of that 90% of secondary presentations, about 2/3 are cancer related. So lymphedema, it's then classified into stages. So we in Australia tend to say we're just stage 1, stage 2, or stage 3. So stage 1 is where there might be some pitting. So pitting is when your arm or your chest could be quite soft and you can press down with your thumb, and when you take your thumb off, it'll leave an indentation. Say you've had your watch on, you might take it off, you've got an indentation. You've had a tight jumper on, you'll have an indentation. So that's stage 1. And often this may not actually it might not be visible in the size of the arm, but there might just be that little bit of pitting. Stage 2, there is definitely pitting, and sometimes this can be really quite thick and dense, and the tissue can feel really hard on the arm, particularly around the forearm or at the back near the armpit here. There's some areas where we can tend to get some buildup with our lymphatics because of how the deeper and the superficial system work through there. And that could be another presentation, Christina, to go into more of that actual detail into that. And usually when you're in stage 2, the pitting or the size of the arm doesn't reduce upon elevation. So in stage 1, your arm might be a little bit up, but then you wake up in the morning and it's fine. And it might be fine for another 2 or 3 days. And then maybe it's a bit hot, you've got more load in your system, and then your arm might come up a little bit and then it will come down again. Stage 2, it doesn't reduce on elevation anymore. And stage 3, we start to see skin changes. So stage 3 is when we the lymphedema has been there for so long, and because it's protein rich, it starts to attract fibers into the tissue, and that's called fibrosis. And some of you may have heard a practitioner talk about fibrosis, or what is fibrosis, and that is where fibers are laying down in that tissue between the muscle and the skin. And we therapists use a few ways to try and break that up. Fibrosis on an arm, when I see it, it's often in a band around the forearm, or it might be along this part of the arm here. Sometimes people have a bit of fibrosis up there in the arm as well. With breasts, if you've had a lumpectomy or a resection, sometimes you can get a little bit of fibrosis, and it's really at the base of the breast. So if you think before I was saying how our body relies on muscle movement and to change tissue pressure. Well, we don't have any muscle in our breast, right? So, and we've got gravity fighting against us. So sometimes you will see some fibrosis, or it might even look like an orange peel kind of skin underneath the edge of the breast. And the ways that you can work on that yourself is you just do some like soft fingers pressing into that to try and break it up. That's fibrosis. We can also get things called lymphorrhea, which is pretty rare to see in arms actually, but that's when the lymphatic fluid starts to come out of the arms. We see that a little bit in legs or genitals, but not really in arms. So, what do you need to look out for? So, I think it's really important to know the signs because from the experience I get from my clients when they come into my clinic, of course, when you've had some surgery and interventions and you've had all of these things happen, you can kind of lose track of your body, like because you've got a new normal now. My body has a new normal now. How does it feel? And that's why doing things like the Tai Chi, or just kind of checking in with yourself will help you kind of think, do I have any tightness? So tightness is in the skin. You can feel it get tight. You'll touch the skin here and it feels tighter than the skin on the other side. Maybe you wake up and your breast feels really uncomfortable. Okay, that's this tightness. The other one is the swelling. So sometimes it's really evident to see swelling in the limb. Aching. So a lot of my clients will come in and they'll say, "Oh, I've just had this really dull grabbing or ache under my armpit." Yeah, and so that aching is often this lymphatic buildup. And then the other thing also is cellulitis, and cellulitis is an inflammation of the skin and is very red and hot. And sometimes I do see cellulitis on breasts. I don't see it very often on arms. We see it a lot on legs because the legs, if you imagine, it's such a long way down from where we collect our lymphatic into the venous system. So the main thing is tightness, swelling, and aching. And another thing to look out for here, so this is from a previous presentation I've done. So when I was saying about the armpit and feeling sore and tight, so that can also be this syndrome called axillary web syndrome. The colloquial name for it amongst therapists usually is cording. And I would say that most clients that I see who have had some kind of axillary work or they've had a mastectomy, if I really pull their arm up and I can pull the skin as tight as I can, I will usually see some of this cording. It's pretty rare for me not to see cording at all in somebody who's had some interventions done around the axilla. Sometimes people don't, most of the time people don't even know they've got it. When you feel it, it's more because you just lose it. You might have some sharp pains under your armpit. It can travel all the way down to your wrist, or you can see here into the elbow. But most people present because they feel uncomfortable and it feels tight. They can't do that full range of motion. So again, that's where exercise and everything is really important because it's going to help you to know your body and you're going to pick up quicker. Oh, am I a bit tighter under there? Because the good news with cording is that it's really easy to treat. And the therapist will do two things. They'll either maybe use like a low-level laser in there, or we might use our hands or our fingers to try and stretch the skin. So it's a little bit uncomfortable, but what we're trying to do is that cord is kind of stuck in what's called the fascia. And the fascia, if hopefully no one doesn't mind me using an analogy of a chicken breast, but when you pull up the skin of a chicken breast, you'll see this clear film, and that's fascia. And we've got that all over our body. And cording is usually this little bit of deeper lymphatics that's stuck in the fascia. So there's not a lot of studies about cording, but I did find some studies that kind of show that around 86% of breast cancer patients do develop some type of axillary cording following surgery. But again, sometimes you might never know it's there. I've got some clients who they'll go, they've said to me, their cording is fine, they feel fine, but they might be out to dinner and they might be turning to talk to someone, and that rotation, so the cord might actually initiate from, say, about the third rib down under near where your bra line is, so you can have the cord right down there, and so you turn to talk to someone and it can really pull. So sometimes I've seen cording that's gone from the armpit all the way down to the bottom rib, and that can be quite a big cord. Sometimes it's just tiny little hairs, it looks like, under the armpit, and I've really got to look for it to find it. So what do we do if we think that we've got some swelling, or we've got some tightness or some aching, or perhaps we've got some orange peely skin on our breast, or things look a little bit different? One of the first things you can do is have a look at this website here, and this is the Australasian Lymphedema organization, and they have a list of accredited practitioners. And you should be, I mean, it depends where you live, but there are quite a lot of accredited practitioners around now, and that would be a good way to start, even to ring and have a conversation with someone. Christina would be a great resource as well, because she can direct you to those things and also help you to kind of know, okay, what is normal? What's my new normal? Are there things that are different? There are also some public clinics for lymphedema. So a lot of people know of, there's a clinic that's called the Mercy Clinic that runs out of the Austin Hospital. We've got clinics here in Ballarat, in Bendigo. There's a clinic in Melton. You need to be referred to the GP, by the GP, to those. If you don't know where to go from those, I just contact where you had your surgery. So contact your specialist and just say, who do you know? I think I've got this. What's going on? Also, we've got in Victoria, it's called the Statewide Equipment Program. So if you go to an accredited practitioner or one of these clinics, or even perhaps, a nurse from your local GP, they can access compression garments for you under this program. Yeah, so it's a little bit different with the breast prosthesis program through Medicare. This you need to have somebody measure you up and send off for the garment, and then you get that there. So there's some things that you can really do, and one of them is to be aware of your body. And the other thing that you can do is exercise, which I'm going to get into a little bit, good nutrition, skincare, and self-lymphatic drainage, which I'll show you. And we've got a sheet that Christina will send out on how to do that. And here I've got this link to the YouTube video or app for this 7-minute Tai Chi. But these are really important, and I'll talk about why now. When you see a lymphatic specialist, they're going to then, like, say you present, you go, I've had this swelling in my arm, or my arm's a bit tight. Well, it will automatically start to be looking at your arm. How does it look? How does the skin look? We'll also touch, right? How your skin feels. Do you have pitting? We use a lot of different diagnostics. There are some pretty fantastic volume change detectors around, like a Sozo machine and different things like that. There's also ultrasound. Another thing we might do is just measurements. Quite simple, measuring tape, wrist to affected arm to non-affected arm, forearm to forearm, largest part of the arm, axilla, and that gives us a really baseline of what's happening. We've got a lot of newer technologies now, and some of these are available for sure in Victoria. And this is on the right here. I've got 4 examples of, it's called near infrared fluorescent lymphatic imaging. That's a pretty big kind of statement to make there. And this is a real-time Okay, real-time assessment. So what they do is they put a dye into your, so this on this figure A, you'll see here they've put the dye in here, and then what they can do is they do a specialized lymphatic massage, like manual lymphatic drainage, and under a fluorescent light, what they can do is track the movement of those lymphatic channels, and also where there might be something that's called backflow. So if you look up at here at figure A, you can see all of these drawings through here. Okay, so what they're actually doing is drawing on the arm to as the lymphatics going through. So I sometimes will have a client turn up with some images like this, and this is fantastic because it gives me a lot of information. When we see something in an image that looks like this, what that is called is dermal backflow. So that means that really not much lymphatic fluid is getting taken up from the tissue at all. Ideally, what we want to see is if you see on the upper arm here, so this person only has lymphedema developing in their lower arm, and then here the lymph has gone into the deeper vessel, and then it's popped out at the deeper vessel here, and then up into this terminus here. That's where the next kind of indication of where the lymphatics is flowing. Whereas in this person here, they've got this is called dermal backflow. So all of that fluorescent imaging that they've put in all of the dye hasn't been taken up by the lymphatic system at all. It kind of disappears a little bit here, but when it gets to here, it's not being taken up there either. So as a therapist, what that's going to help me is to know which way I'm going to do this manual lymphatic drainage. So that's a pretty new technique. It has been around about 5-6 years now, but it's fantastic. So a therapist then, we look at if somebody comes and they've got some swelling in their arm or in their breast, we're going to do either a reduction or a maintenance phase. So reduction is where we might do a combined approach of manual lymphatic drainage to try and stimulate. There's some manual lymphatic drainage down there. Really try and stimulate that lymphatic system and start to get it drawing and working more efficiently, taking in more of the fluid, more passengers into that train, because then anastomoses, those little backway pathways will start to connect and work a lot better, and that will help to drain the fluid. We might do bandaging. That bandaging is a really important part if we need to do some reduction. We might use low-level laser therapy, which helps to break up the scar tissue and also the fibrosis, or we can use our thumbs for that as well. Lymphatic taping, you can see here. This is fantastic for the breast and actually the back, because it's really hard to compress a breast and compress the back, because you need to be able to breathe and move. But what lymphatic taping does, it's a tape a little bit like kinesio tape or rock tape, things that you see tennis players, sports people have. And what we do when we apply it is we actually move the skin, then we lay the tape down, come up, move the skin, lay the tape down, so that when you move then, the tape actually puckers up a little bit, and that pulls on those initial lymphatic vessels through the collagen fibers and starts to help to change that tissue pressure. So this type of lymphatic training is fantastic if you have some kind of heaviness under your breast. That's really good. And then over here, we've got these sequential intermittent pneumatic pumps, and there's a few companies that make them. And what they do, the intermittent part is that, remember how I said the lymphatic system is a really slow system? So we don't want something that pumps and then stops, pumps and then stops. We want something that pumps up, okay, puts quite a bit of compression in, and then it releases, and that's that moment for the lymphatics to take the fluid in, and then for it to get to the next section, and then to the next section. So these are really great especially if like a lot of my clients, you live regional or rural, and you want to be able to do something every day. You've heard people, all therapists and things, we talk a lot about compression garments, and compression garments are really good to help the lymphedema from getting worse. One of the things they do is that they put compression but on that space, so between the muscle and the skin. And what that does is prevent the filtration of fluid wanting to come into that space where there's a lot of proteins in that lymphatic fluid. And when a therapist is looking, okay, what kind of compression garment am I going to use? They're going to be looking at what type of pressure. They'll also look at the type of knit, which is a circular or a flat knit. So a flat knit is fantastic for people who might have a quite big overhang or quite a big elbow, because what it does is it's got a seam, and so it doesn't go into the creases, right? Whereas a circular knit is a bit more like this. And so if you've got quite soft skin, but you've got a bit of shape in your arm, what can happen is when it's circular knit, it can go into those creases and feel a little bit uncomfortable. We'll also be looking, especially, can you put the garment on or off? Like that's a really big thing. And yeah, compression garments are sometimes used after bandaging, but some people, if they come in and they're just feeling they're like a little bit achy, we might just go straight into a compression garment, depending on how their skin looks. And then compression garments then come in different medical classes. And if you think when you get like a compression sock from the chemist to wear when you go flying, that's kind of a zero, and that's 15 to 20, so we're talking millimeters of mercury pressure. And then we have medical class 1, 2, and 3. These days, like a medical class 3 is pretty firm, and I would rarely prescribe one of them, mainly because you're better off to have a class 2 that you feel comfortable and wear every day than a class 3 that doesn't, that feels a bit too hard to put on. So one of the things I mentioned before that you can really do to prevent lymphedema and just for your general well-being is to exercise, so that participation in exercise can prevent lymphedema to an extent. And also, because you're going to be using this muscle movement, it also helps you to feel and know your body a little bit better, your new normal. And there also a lot of evidence is that for those people who have cancer-related lymphedema, that it may reduce the lymphedema, but it definitely has other improving outcomes and health outcomes. So I got this all from different studies previously, but most people who have done exercise over a time, if they've already got lymphedema, over time they say that they have improvement in their symptoms, such as if it feels painful or heavy, and that there was no trends in most studies relate to the degree of how much exercise you did, or if the exercise was supervised or not exercise. We just know that any exercise is going to be beneficial. And also that it's just that matter of doing it consistently over time. And you might want to do so you might want to look for opportunities just to be more physically active. You don't have to start to, like go to the gym 7 days a week or anything, but just look for those opportunities, taking the dog for a walk, parking the car a little bit further than the shops than normal. The other thing you might want to do is, which I'm a really big fan of, is planned exercise. So if you know that you've got a group of friends that you like to go walking with, or you've got some people you can do some weight training with, like you get together with them, it's in your diary and you have to go, especially in winter when we can all start to want to hibernate a little bit. We should include aerobic and resistance training. and it should be moderate to vigorous intensity. So you might, if you're walking, all of a sudden go, I'm just going to walk 50% faster for the next minute. Okay, and then your watch changes, and then for the next minute. So just to try and get that intensity up. And but always start with a shorter duration and lower intensity. And yes, small increments. This is so you'll get all of this from Christina. And that certainly, if by exercising, if you've already got lymphedema and you're exercising and it makes it worsen, you should see a lymphedema therapist because there might be something else underlying or a different type of exercise we might suggest you should do. I love this, is that the Cancer Council did a statement a while ago that said that if the effects of exercise could be put in a pill to fight against cancer, then it'd just be fantastic because the exercise is so important in reducing the risk of secondary cancers. And they used to have this on the bottom of their email a lot at Peter Mac. And this is a blog about every cancer patient who be prescribed exercise as medicine, and a few different links from there as well. So these are all in the PDF that Christina will send, so you can have a look in your own time. In regards to nutrition and lymphedema, we know that lymphedema usually coincides with an inflammatory state in the tissues. So what we tend to get is this protein-rich fluid, and then that creates more inflammation, and that creates more protein-rich fluid and more fluid across. So that's why it starts to develop over time. And the research into a relationship between diet and lymphedema, like there's pretty much nothing. Like it's very rare, and if it is, it's really varied. It's like someone's just done something on oils and someone's just done something on eating more protein. So in general, the key findings from most, and I found all this from an Australasian journal, is that dietary intake can play a role in the management of lymphedema and also in that inflammation that you might have in your system. So if there were some recommendations, I like to think more about putting things in, not taking things out. So you just want to eat more food from a varied 5 groups, keep hydrated, swap saturated fats for unsaturated fats, and definitely down here, no fad diets, okay? No fad diets, but also just try and reduce that high fat and sugar and salty food. So it's basically just to have what your everyday healthy recommendations are for diets. So we can get to some questions. It's kind of a whirlwind presentation. I'm always surprised at how quick the time seems to go. So the first thing I want you to remember is that early diagnosis gives to much better outcomes. So as soon as you feel a change in your body or in your breast, you need to try and contact someone pretty much straight away, because the earlier we get onto it, the much better it is to reduce and manage. And sometimes that management, like I've got some clients that I'll just say, okay, you should wear your compression garment twice a week. They've gotten to that point, or if they actually don't even wear a compression garment because their arm's fine, but it might occasionally get a bit achy over summer, so they'll start to wear their garment then. And it might get achy over summer just because we get hotter and we increase the load into our lymphatic system. So knowing your body is really important. So that means touching, feeling your body, moving your body so you know what feels normal, what your new normal is, and that self-care of exercising, looking after your skin, and just trying to, eat as well as you can. In Australia and New Zealand, we have a Lymphedema Awareness Month, which is every March. And what they're trying to really do is promote what lymphedema is, and so that people can get access to treatments and services. They're also trying very hard to get it under Medicare but it is not proving very easy. And I've got two websites here. That's that website for general information and then also how to find a practitioner. And most practitioners, they're really happy for you just to send them a message. I'd just like to have a chat. Okay, we're all in the industry of trying to help people have their best outcomes and to also be, autonomous so that you don't need to see a therapist all the time. And they're really open to just having a discussion or even to come in and take some baselines. Like they might come in, take some measurements, take some photographs with your permission that will put on like a sealed electronic file. So at the end of the PDF, you'll see that here's an interview that I did on ABC Central Victoria about lymphedema. And I guess now I'm open to, answering any questions, but also we might not get through them all, or there might be some questions that come up later for you. And I'm quite happy for you to email them through to Christina because she might have some other things that she wants to chat to you about now. So thanks everyone for coming in. I'll just do stop share here. And all that was a whirlwind 49 minutes.
Very informative though, and a lot of interesting things you touched on, Sarah. Anyone have any questions for Sarah? Feel free to unmute yourself.
Oh, I do, if that's okay. Thanks for the presentation. That was really interesting. I haven't got lymphedema, but I've had a clearance and 37 lymph nodes removed. At the minute, I've got pneumonia, so this is what's made me think of this. I'm exercising regularly, but I've read that if I'm not exercising at my normal pace, that I should ease back in again with lymphedema, particularly doing weights to not put too much pressure on my arm. I'm wondering, is that the case, and how do I manage that sort of easing back up to where I was?
Yeah, that's a great question, Andrea. Most research now says that not to worry too much about like overloading your system too much, right? With exercise, that really you're just going to step back in. Of course, like after any surgery or recovery, you're going to step back in at perhaps doing lighter weights, less repetitions, and then just increase over time back to where you were. It's like if you've never run a marathon, you're not going to go out and go, I'm going to start training for a marathon. But if you used to do weight training and do yoga and do Pilates and all those things, you want to get back into doing those activities, but just being a bit patient with yourself. But certainly like exercise and weight training is fantastic for changing that tissue pressure between the muscle and the skin. Like there's a really lot of evidence in how much that helps your body to move and recover. So when you're over your pneumonia, yeah, and your lungs, you can breathe a bit better. But yeah, just be gentle with yourself and just go back through like a normal program. And if you feel like it's a little bit tighter under your armpit or somewhere, you can ask for more stretches at the gym. That Tai Chi that I sent through has a lot of movements like this and like this. So it's all about opening and changing this tissue pressure around your chest and through your ribs as well. So
Okay, yes, I think
that's just beautiful, yeah.
Oh, good. Yeah, I think I've been really nervous and I sort of go back to kind of 1 kilo and build myself up. So I don't need to be that particular
No,
about it. Great.
no.
Okay.
I mean,
Thank you so much.
you don't want to get out there and start slamming 30 kilos over,
Yes.
but you want to just, take it steady as you go back.
Oh, great. Thank you so much.
Yeah. Any
Hi,
other?
yeah, hi Sarah, it's Jenny.
Hi, Jenny.
Um, I've had the axial lymph node dissection on my right side. I did get some visible lymphedema after overdoing it about 6 months after surgery. And I got some treatment for that, but didn't go as far as a compression sleeve. What I've found post that is, apart from being just a little bit more careful before I overextend myself, is that I can feel when there's a little bit there. It's probably not visible to normal people, but it can be measured, and it's fairly persistent. And it's back again at the moment. And I'm just wondering if something like a compression sleeve at the lowest level, would sort of be the next thing to do.
I think, Jenny, I think that would be good, because what you're describing is sort of around this stage 0, where your system has just gotten a bit overloaded at some time, and that can happen. But by wearing that compression sleeve, it's going to stop. So if you imagine, it takes 18 hours for fluid in the system to get through here. So it's not the build up from the day before, it's the build up from the week before.
Yeah.
And you can decide, like, just a class 1. I can tell by, your image, your arm is pretty fine in like circumference. So there'd be lots of garments available that would fit and feel very comfy in a one. And what that's going to do is squeeze the space so that the time that you've got it on, the fluid doesn't want to go into that space anymore from that day. So it means that, like, today's Thursday, you've got your garment on. For Thursday, that fluid doesn't want to get into that space. It helps to push it up through the lymphatic system. And then over time, you're moving a little bit of fluid from that Thursday, but also the Wednesday, so it'll start to then catch up. And it might just be something, Jenny, that if you've got a day where you're gonna, something that it's really great to wear compression when you're doing things like gardening or exercising, because then you're getting your muscle interacting against the compression garment as well. So even if you feel a bit hot, but yeah, I'd suggest that that's just a great way for prevention. And it's not something that perhaps you need to, wear every day. But even if you start to feel your arm to come up a little bit, I'd be putting the compression sleeve on, leaving it a couple of days. We never sleep in those kind of compression sleeves.
Okay. So don't sleep in it, but wear it during the day.
Yeah.
Okay.
You can get garments that you sleep in at night. There's one called a Comfy Wave by a company called Haddenham. There's one called a Mobidoom Auto Fit, which has these little foam bits that help to make the micro massage on the skin. Yeah, so there are some things, and certainly I've had clients who perhaps might work in the medical field, like they're paramedics, and they can't wear a sleeve really because because of infection control patient. So what they'll do is get home at night, put on their Mobiderm garment, Velcro it up. The next day, their arms really reduce back to normal. So there are lots of other things you can do. Like maybe for you, Jenny, you might like to just try something like one of those nighttime garments, like the Comfy Wave, something that you can just easily put on in the evening.
Yeah. No, it's been about a year since that initial incident.
Yes.
And it's been manageable since then.
Yeah.
Yeah, but I can still feel it. And I was noticed when I was walking today, that's why my camera was off. It's still there, and despite the sort of massage and the exercise, and I can consistently exercise, it's just, I know it's there.
Get on to putting some type of compression into the scene. And I'll say to my clients a lot that doesn't mean you have to wear it every single day for the rest of your life. And like if you're going to a function, you cannot wear it. But the more you wear it, the more support you're giving your system.
Yeah, and that sounds like it's supporting it to do the right things rather than leaving it and letting something like fibrosis develop longer term.
Absolutely. Yeah.
Great. Thanks, Sarah.
Just going to ask a question. Hi, everybody. Jenny, Sarah, thank you for that. Sorry, I did join late, and I look forward to seeing the whole presentation. I also have had a complete lymph clearance, but literally you've stepped up from Andrea to Jenny to me, who unfortunately was diagnosed. Well, I had like an acute onset lymphedema almost 2 years after my lymph clearance and my mastectomy. So I was probably like Jenny, I was pretty aware. I was seeing a lymph physio because I'd had the clearance. I'd had my SOZO level baseline. And then I, unlike Jenny, just missed a few warning signs. So I realised that, when I my arm really did blow up, I realized that there were signs in the weeks prior. So I was trying on watches and I realized, I was like, oh, these straps are too small. I'll need a bigger size. Or I put on a leather jacket and went, God, this leather jacket's getting tight, but didn't think, oh, it's only on one arm. What is going on? So, and then I know there's new protocols that say it's fine to have blood tests in your breast cancer affected arm. There's no issue with that. But I actually did have a Zometa infusion into my cancer affected arm because they couldn't find veins on my right arm. And probably because they've been trashed from chemo, but that triggered for me a full-blown, lymph blow up on my left side, which they've tried to manage for a year now. I'm in both the Comfy Wave at night pretty well consistently every night for the last year. I've got I think I just checked my sleeve. It's a class 2 sleeve, which I wear during the day, and I have the lymph pump. There we go.
Yeah.
My lymph pump is set up there, and I'm on that and have been on that almost every night for 12 months. So that was kind of my preamble. And my question is, it's still quite bad. And my physio, so I see Kate Rogers in East Melbourne, and she has said to me, just because we want it to be over doesn't mean it is, because I got a bit lax over summer going, this is just enough. I'm so tired of it, of this constant sleeve wearing and the impact. But I'm wondering, I'm a year into this acute stage, really. At what point does someone like me go, okay, do I entertain this, surgery outcomes? I know that's kind of new to do the surgery, but at what point is that a valid option for someone like me who is still in this lymphedema space, very much impacting my day-to-day?
Yeah, thanks for sharing that, Megan. I mean, that's your story is actually pretty recurrent upon a lot of people I speak to, and certainly people who come into my clinic. I think it's a very personal choice, and it's up to do with how much is it impacting your day-to-day life. So I've got some clients who are older, and some of them they just go, well, I've just got a big arm and that's it. Like country people, I've just got a big arm and I don't like it when people say things to me at the supermarket. But then also other people who might actually sorry, someone just waving at me through the window. Am I finished? Other people who it really impacts their life and what they're trying to do. I don't know a lot about surgeries for arms. I know a lot about legs surgeries and seeing that. But the other thing I'd suggest, Megan, is to do I don't know if you've ever done some bandaging reduction phases, but bandaging can really, really help. So I do a lot of bandaging at my clinic, and I was associated in educating therapists around this product called Moviderm, but there are other bandaging types out there as well. And sometimes that can just a bandaging protocol every now and again can just help to reduce that arm just a little bit more. So it sounds like you're kind of in the management stage, which is good, but we might just try and reduce it and just get down a little bit. And sometimes I can get somebody's arm down and might just pop up a little bit after 6 months, and then we can get it down again to a point. So I'd be looking at doing things like bandaging protocols before you went to any kind of surgery as well.
No, that's really good advice. I was just going to say one more thing, which was just to be really aware for everybody on the call who's obviously in this unfortunate space, is I ended up with a cellulitis infection in my arm as well. And even though I considered myself really literate about cancer, breast cancer, lymphedema, all of this stuff, it still really took me by surprise when I noticed these small little dots underneath, in my forearm, And I was like, did I get bitten by a mozzie or what was that? And the way in which it came on was so fast, and I felt really unprepared. Even though I felt so literate, the cellulitis infection came on so quickly, and it was a real shocker. So now I'm really aware of monitoring and making sure I'm checking that arm.
Yeah, it is something, Megan, like I think it's very hard to keep track of everything that's happening.
Right?
And it's that new normal. And that's what I mean with doing exercises and things. And you get to know, well, what is normal. And there still is, even though like Fantastic Thick Pink and Christina give us the opportunity to talk today, but there's still not a lot of information is out there about lymphedema and what to do and what to look out for, and somebody to check up on you, to after 6 months ring up, oh, how are you going? What's done? Have you noticed any changes? And then if you'd have said something to me like, I've got that jacket was a little bit tight to put on. My alarm bells are
Yeah.
but yeah, we don't have that follow-up in the medical system, Megan. So the one thing I'd say is don't be hard on yourself, because it sounds like you've done amazing. You've got everything there, the pump, the compression sleeve, the comfy wave at night time. Try the comfy wave in the pump. Have you done that?
Yeah, no, I do that every day. Yeah. And I think, you touched on it before about Medicare. It's financially, I'm grateful I'm in a financial position that I did just put a $2,000 pump on my credit card and go, oh, well, I guess I'm buying a pump then. But I'm really aware that, I am in a privileged position that I could buy the pump. I have been able to go to regular physio and go through that draining, but it's expensive, and it's an incredible financial drain. Again, I check my privilege because I can't afford it, or I'm lucky enough to just, put it on the credit card and deal with it. But I feel really terrible for people who, and as you say, might just go, oh, well, I live in the country. I just have a big arm now.
Yes,
Suck it
yeah.
up. Yeah.
Yeah. No, it's really yeah, they're really important points, Megan, that you're bringing up there. So, I'd love for there to be an opportunity that it should be like, okay, you've had breast cancer. Here's your voucher for 10 visits to a therapist, yeah, to a lymphedema accredited therapist from the public healthcare system. I think in the UK. Certainly at the last conference I went to in Denmark, they did some big trials in the public hospital where people were given, they had baseline measures done before surgery. And that's where we really want to get to as therapists, is to see someone before they've had their surgery. So we have these baseline measures either through a SOZO or photographs or also quality of life questions. Because what you're describing a lot now is also this quality of life, and people don't think of that as much. It's being able to do the things you want to do, afford the things that you can do, and not have this drain and the constant, I guess, there is a fatigue factor, Megan, in what all of you are going through. You get tired of it, you get tired of the appointments, you get tired of these things, and then lymphedema comes on top. And it's kind of a little bit like, oh, well, you've had all of your surgeries, you're here, but sometimes these things afterwards create more of a toll on our quality of life than the actual, than the initial surgeries and things.
Right, because you're thinking about it every day because you're in 24-hour compression, and I have to find time to fit in 45 minutes on my lymph pump every day. Like so Jenny, I would say get onto it now if you've got that very early stages to avoid, that.
Yeah. Thanks, Megan.
But thank you so much, Sarah. It was really interesting.
And I have to say, on top of that, so one of the things that I was just thinking about as we were going through that is that with the letrozole and the aches, and I've got this weird muscle pain in my other arm, I'm going, I don't know if I'm going to have the strength in my hands to pull on a compression sleeve. So it's got to be a fairly gentle one.
Yeah, the comfy wave is really easy.
Good. Yeah, the Comfy Wave for nighttime would be absolutely easy as, or the Mobiderm, like they're both very good. And you can have, like, I've got a client came to see me yesterday who has had so many complications with her shoulder from different surgeries and things. Like she had all these huge infections in her shoulders, so she has no muscle movement whatsoever. But and she bought her little applicator, which is like a plastic crescent. And because I got her a new sleeve yesterday, and she bought it in, and you put that, and then you put it on a desk, and it holds, and you put your arm in and there, and you pull from here. So there's heaps of applicators around, but yeah, that's it. Yeah.
Thanks.
Plus, you can get them in cool colours now. That's my like blue denim one.
It's not all brown. The world is no longer strawberry.
Anything that doesn't show the dirt, please.
Yeah.
Hey,
Thanks
Sarah.
so much
This
for
is
sharing,
Gomi.
Megan. Sorry, was it Gomi?
Yeah,
Yes, go on.
just a quick one. So, lucky Megan brought it up before. So, people like me, like I lost my job because of the diagnosis. I was diagnosed twice. So, I've got lymphedema, like I've got lymph nodes removed from both my arms. And I've had this discomfort for more than a year post-surgery. And I kept mentioning it at every visit to the specialist, but no one even suggested it could be lymphedema, because the only thing they kept telling was, if there is swelling in your arms, then it's lymphedema, then let us know. But I could feel the heaviness, and it was, my quality of life was so compromised because I couldn't do anything. After nearly 2 years, I literally cried to the breast care nurse and said, I'm not able to do any chores at home. I'm not able to do my job like at work. So she referred me to a lymphedema clinic at Mornington. I
Yeah.
went there. One look at me, examination, they were like, oh, you've got cording, you've got pits, and you've got the knotting and breast lymphedema, arms. I'm like, I could tell there was something different in my body, but nobody heard what I was telling them about my discomfort. And then on top of that, they gave me a list of private lymphedema clinics and said, we can only teach you how to do your own self massage. Whereas I've got the issue in both arms, how am I going to be able to do the massage? It was ridiculous. And when I contacted the private ones, they're so expensive. $180 for 30 minutes and then 200 something for an hour. It's like literally 2 years, 2.5 years now. And I haven't been able to afford to go to a private clinic. And I wasn't getting the drainage or the massage at the public system. So what are people like me supposed to do? Just nothing? And
I would get you. No, it is hard, Gomi. What is, do I say Gomi? Is that how I say your name?
yeah.
Yeah, it is really hard what you've gone through. And it's pretty common also. Like sometimes when by the time people get to me, they've been out on a journey for 2.5 years, with these changes and things. What I would suggest is, first of all, for compression garments, you should be able to find somebody who can get that for you through this statewide equipment program, which is a subsidized garment program. To access that, if you have a look at that practitioner's website, but also I don't know if Frankston Hospital has something down. I'm trying to think. I don't know the southeastern suburbs that well, but certainly I think a place like in I'm going to say like Mordialloc or around there. I think there is a public lymphedema clinic down that way. So I would go next time you go to your GP. I'd be there saying I want to have access to 5 therapy sessions with a physio that's going to be on that enhanced enhanced auxiliary healthcare program. So you get 5 sessions a year, and ring up, try and find, you'll have to get on the phone, unfortunately. But if you get on the phone and ring some private practitioners in your area, if they're a physio or an osteo base, they should be able to do that program for you. And then you should even be able to get like the healthcare nurse or the nurse practitioner would be able to prescribe some garments for you. And they
So
would be
those garments, Gomi, they're free. Like, you do have to wait a little bit, but as Sarah says, it's a statewide program. So they will be provided for you. So yeah, it's well worth it. It's the SWEP program. I do have their contact, but as Sarah says, if you can get into a public health clinic or a physio, it should be able to just measure you up and then get that garment sent to you.
Okay. Thank you.
And as with the healthcare plan as well, you get 5 subsidised through Medicare visits to the physio for your lymphedema. Yeah, I was just going to say that is a thing, and it does work. So
I did check
it's
that
better
out
than
though. It's not bulk build. So again,
you're
part
still
of it is
yeah.
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 Yeah. It's not
Okay.
It's not easy, Gomi, but one thing you can do is, those, it sounds so simple, but that Tai Chi that I've sent, and I've even got one just for breast and chest, like that movement of your arms and your body is really important. And if through that sweat program, if you've got any swelling in your breast, they've got fantastic it's called a comfy, again, it's a comfy wave, but it's like a big boob tube, and you can wear that at night time, or you can do those garments, and you can get multiple garments. You don't just have to get one thing, but that's what that program is for. Yeah, the statewide equipment program.
Yeah, and we've got a lymphedema massage at the centre as well, going for free. So yeah, you're welcome to register for that and come in whenever you felt like it as well.
And team, I've probably got time for one more question, sorry, because then I've got to, as if somebody was waving at me at home before, I'm like, yeah, I know. So I've got Natalie came up before.
Yes.
So Natalie, yeah.
Hi, thank you so much. I'm not sure if it is lymphedema yet. I have been monitored at St. Vincent's Public Hospital around January, February. It went up to like, I think in sort of orange, green, orange at the start. So they gave me a sleeve, and I've been monitoring sleeve and just drain massage at home as the best I can. My question is, so I have a carpal tunnel from my medication, like exemestane and stuff. And I've had an injection. I had one injection in this arm before my lymphedema, and I've just had another injection in my other arm. This is uncomfortable, like the tingling and numbness, but will I potentially cause an acute lymphedema if I was to have an injection in my affected arm? Do you know how?
Usually not, Natalie. I'll say usually not. They tend to say now that like the evidence is, I mean, unless it's like an infusion or something where you've got it depends on the type of injection, but if it's an infusion where you've got a drip in your arm for 2 days or something like that, that's a little bit of cause, like you could get a bit of infection in that site. But if it's just an injection, it's usually fine, or to take bloods, it's usually fine, because it's a very tiny little pinprick, and that's not going to create too much load on your system. It's not going to create damage to your system.
Okay, because I know by the ultrasound they did on my other arm now, like there is inflammation there, and inflammation will also kind of not help my lymphedema, will it?
No, but it also, I mean, it's just creating more load on your system. But reducing that load by having the compression garment, off drainage, and by being aware. So that increased load, we can do a little bit more to try and remove that fluid or prevent it from staying there.
Mm. So if I say was to have an injection, a steroid injection in this arm as well, should I do anything just to like pre-course? I heard you were talking about nighttime sleeves.
I would, if it was me, I mean, I'd chat to the specialist as well, because the other thing, you're in pain and you're not moving your hand properly.
Mm.
Eye on it for lymphatics is muscle movement and hand movement and everything.
Yeah.
I'd have a chat with the specialist about it, as maybe the day before you'd go and have some lymphatic drainage done, or something, just so that your system is primed and pulsing as well as it can.
I'm also traveling on the 27th. Like I'm traveling overseas to Sweden in a couple of weeks. But that should be fine.
Yeah. So
Just wearing the sleeve.
Yeah, what can happen sometimes on the plane is because they drop the air pressure, right? Drops, and that's why we can feel a little bit swollen in our legs, but you've got the garment on. So yeah, I'd travel. They used to say, oh, you can't fly without a garment, but now all of that's changed again. Like as they get scientific evidence and studies done, what you're doing on the plane is like occasionally just this kind of muscle movement. This is for everyone as well. Don't leave your arms just on the side rests, not moving for ages. So just to do all that muscle movement, and maybe you might just do some stretching, in the plane, just those kind of things. Yeah.
Okay. Thank you. Thank you so much.
Pleasure.
Very helpful.
Thank you so much, Sarah, for going over time. I just want to quickly sort of circle back. Megan in the chat said that she does weights and gym, which has helped her, just as Sarah said. So that's really good. And just before we finish up, Sarah, if anyone watching today wanted to benefit from anti-lymphedema support from you, what's the best way for them to get in touch with you?
I'm quite happy, Christine, if anybody here that's seen the thing today wants to contact me with just some general questions, I can just email and say, hi, it's me. I was on the Think Pink thing, and because I might also know some therapists to send you to in your region as well. So we're a pretty small group of people, so we all kind of know each other and what we do. So
lovely. And again, thank you so much. That was absolutely amazing. And I really hope that in this space it can develop further and we can definitely get the word out there about lymphedema, because I feel it's definitely one of those things that it gets so overlooked, and so fortunate to have you on with Think Pink, because I think this was really great and I really hope to do something in the future.
Thanks, Christina. My pleasure. Hope everyone has a great day.
Likewise.
Thanks, Sarah.
Thank you so much.
Sarah.
Thank you.
A great presentation. Thanks, Sarah.
Thank you.